you to our kickoff event to celebrate this week's EMS Week. This week is a time to recognize and celebrate the extraordinary men and women in emergency medical services, or EMS, our paramedics, EMTs, emergency medical dispatchers, and clinical support teams who respond every day with skill, courage, and compassion. The theme of this year's EMS Week, We Care for Everyone, speaks to the true spirit of EMS, a system built on compassion, inclusion, and unwavering commitment to every person in every neighborhood. At DC Health, EMS is a core pillar of HISPA. HISPA leads our city's efforts to strengthen and coordinate healthcare delivery, healthcare quality, emergency preparedness, and public health resilience. EMS is a unique but essential component of our healthcare system, as it sits at the center of a dynamic and vital intersection where clinical care, public safety, public health, and emergency management meet. EMS is there when a heart stops, when a car crash happens, when a community is struck by disaster. But EMS is also there in the quieter moments, providing community education, advancing health equity, and ensuring every resident and visitor can access timely, high-quality care. EMS clinicians are not just responders. They are educators, innovators, and essential partners in our healthcare and public health system. In our nation's capital, EMS is a strategic partner, and the professionals comprising the system form a foundational component of our public health infrastructure. They support our hospitals during surge events, participate in real-time health surveillance, and stand ready to respond to everyday emergencies and large-scale incidents. This week and every week, we recognize the courage, compassion, and commitment that define EMS in the district. We invite everyone to join us in honoring our EMS clinicians, emergency medical dispatchers, and others who support the EMS system here within the district. I am honored to introduce Dr. Ayanna Bennett, the Director of DC Health. Dr. Bennett stands out among her colleagues nationally as a champion of EMS, recognizing its immense importance in an effective and high-functioning healthcare system, especially within the District of Columbia. Dr. Bennett.
Thank you, Sam. If I did not respect EMS, Sam, who has started his career as a paramedic, would have taught me better at some point, I think, but I already knew. Good morning, everyone. This week, we celebrate emergency medical services, which is all of our clinicians, 911 call takers, educators, who are the first responders of our healthcare system and who ensure the health and safety of district residents every day, sometimes at risk of their own lives and health. These professionals are tasked with providing calm, life-saving medical care when individuals are facing some of the worst days of their lives. Across all 8 wards, we take great comfort in knowing well-trained, caring clinicians are only a 911 call away when someone we love is having a severe allergic reaction, cardiac emergency, or has suffered a terrible accident. Your timely actions in these situations can make the difference between life and death. We also thank the additional 15 EMS agencies that help support our college campuses and special events and perform interfacility transport services that help move critically ill patients throughout our healthcare system within the district and beyond. So today, on behalf of Mayor Bowser and the district residents you serve, I want to say we see you, we thank you, we pay tribute to your selfless work, and we're here to honor your dedication to the day-to-day life-saving services that you provide to our residents and visitors alike. I'd like to call up DC Fire and EMS Chief John Donnelly to receive a proclamation from DC Mayor Muriel Bowser recognizing EMS Week. I'm not going to read the entire proclamation because there's a lot of whereas, and it's maybe not a crowd pleaser, but it is heartfelt. But I do want to say that the theme, We Care for Everyone, echoes the importance of EMS services, and it offers a unique opportunity to acknowledge and appreciate the impact and life-saving dedication of our emergency medical services community. I, therefore, the Mayor of Washington, D.C., do hereby proclaim the week of May 18th through 24th, 2025 as Emergency Medical Services Week in Washington, D.C. Signed, Muriel Bowser.
Sure. Thank you, Dr. Bennett. Good morning, everyone, and happy EMS Week. My name is John Donnelly, and I have the honor and privilege of serving the residents of D.C. as the Fire and EMS Chief, which also means that I'm the CEO of a pretty large medical organization. We provide a lot of services, but none of those services work without our partners. And I think that's really, too, what we're here to celebrate. I really want to start by thanking Mayor Bowser for her continued support and for the proclamation recognizing EMS Week. Thank you also to Dr. Bennett, Sam Hurley, and the rest of the team at DC Health. Without your work and your partnership, we would not be able to do all of the amazing things that we do in support of our citizens every day. At DC Fire and EMS, we highlight the importance of emergency medical services every day. 80% of our work is in EMS, but 100% of our employees provide that service. It's an important distinction when you hear that number. This year's theme of We Care for Everyone could not be more fitting, in my opinion. It's what we do every day. What's exciting is that at the heart of our work, treating every patient with care and empathy remains constant. The tools we use are always evolving. This industry is advancing rapidly, and saving interventions happen, and they come to us as an opportunity. And to make those changes, we need DC Health support. So at DC Fire and EMS, we're not just keeping up, we're leading the way. In the past year, we have introduced whole blood products to help patients who have lost a lot of blood. And this has resulted in an increase in lives saved. We've expanded access to automatic external defibrillators and increased bystander CPR. Both of those things make somebody that you love have a better chance of surviving sudden cardiac arrest. And remember, if you learn CPR, the most likely person you're going to use it on is one of your relatives. So please go learn CPR, sign up for Pulse Point so you know how to find an AED no matter where you are. We've grown our community risk reduction program and enhanced our mobile integrated health unit. And we've implemented new innovations like buprenorphine administration for opioid use disorder, and in partnership with DC Health, a home vaccination program, which also allows us to talk to the people that are at most risk of fire death in this city, an opportunity while we're in their home to talk to them about fire safety. So it's like a double win. Dr. Bennett talked about 911 and the importance of that and the call takers, and how when you call, you know we're going to come. I'd also like to add to that when the call takers ask you a series of questions, they may determine that the nurse triage line is a better option for you, and refer you to a nurse so you can talk to a healthcare professional, maybe get a prescription or get a doctor's visit right away, and save you that trip to the emergency room. But while all of these neat programs and innovation go on every day, at the core of our operation is the 2,350 employees that we have. And today, and like every day, I have two missions. One is to make sure our providers go home safe and that the people they're serving are safe. And the second part is to do that through recruitment, training, and support of these people. One of those things specifically is growing a paramedic workforce. We have recently announced a partnership with the UDC and Howard University Hospital to grow a program in the district. There's also some other programs going on. We have a recent graduate, paramedic Sierra DeLone, from GW's paramedic program. She's somebody we're very proud of, and we'd like to invite her over to say a few words. Thank you all. Sierra.
Thank you, Chief Donnelly, for those thoughtful remarks, and good morning to everyone here today. My name is Sierra DeLeon. I am a recent graduate. So as we celebrate EMS Week, I'm honored to be here with you all today As both a firefighter for the District of Columbia and EMS for the last 6 years, 6 years, and as a recent paramedic school graduate, I've been asked to share a bit of my why with you here, and I'd like to do that by reflecting on what brought me here today and what continues to drive me to move forward in this profession. This is EMS Week, and we are here to celebrate the immense, incredible service that pre-hospital care provides to the nation's capital. I just want to take a moment to thank DC Health and all the EMS providers out there for the work that you do to keep our DC residents and visitors happy and healthy. We all know what it sounds like, those sirens echoing across any and every neighborhood at any and every hour, because let's be honest, emergencies often don't schedule ahead. And many of us here know what it feels like to respond, to act, and to care, no matter the time or place. I started my journey in EMS 6 years ago as an EMT, and in January of 2024, I made the decision to enhance my skill set and broaden my impact by joining the inaugural paramedic class at the George Washington University. Shout out to Dr. Kat Ogle and Gresham Wills. What it is that made me to make that decision is very simple. 2 concepts, legacy and inspiration. First, legacy. Every time I have the opportunity to honor the people who came before me, I'm gonna take that opportunity. From the trailblazers of Pittsburgh's Freedom House Ambulance, including Dr. Peter Safar and Nancy Caroline, who helped develop and define paramedicine in this country as it is today, all the way to my own grandfather, who worked tirelessly through the challenging social climate of Buffalo, New York in the 60s and 70s to become a skilled and dedicated fire investigator. And to the colleagues I work alongside to this day, who inspire me to grow and serve with purpose. They have all worked to create an incredible foundation for which I can build and others can build as well. The second concept, inspiration. Over the last 6 years, I worked beside paramedics who do incredible things I want to learn to do myself. This profession is one that constantly challenged me and us to level up by being proactive and creative as we approach the unprecedented and constantly curious. When I discovered my pathway to a higher level of care, there was no question in my mind. I've seen the difference that pre-hospital intervention makes up close and in real time. The impact is undeniable. I'll now turn it back over to Senior Deputy Director Hurley. Thank you guys so much.
Thank you, firefighter paramedic De Leon. To our EMS teams across the district, thank you. You show up every day and demonstrate that we care for everyone. You remind us that caring for a community means meeting people where they are, when they need it most. You are the lifeline of our community, and DC Health is proud to stand beside you today and every day. Thank you, and happy EMS Week.